hospital are enemies for whatsoever reasons that gets to appeal only to you. There are some diseases and infections that you will never ever get to know or get to know the solution. Why? Because you have not taken yourself to the hospital. So there is a high probability that you will just go about taking medications for things that are not there, like we have always made mention here. Symptoms for diseases, infection and all may look alike, but the real disease or infection might just differ. So when we talk about the gallbladder, we talk about a small organ that gets to help you in digestion. You should be able to know that this structure is located under your liver, and its function is to store and concentrate bile. Now let's talk about the bile. You know, when you buy your chicken, that small green thing that make when one cutter, make sure so you not cut that bile. Yes, for some people you feel like that part, that particular part is only for animals. Maybe you have only seen it in chicken. You just know that if it gets burst or if it gets something goes wrong with it, the whole chicken is going to be bitter and all. And the way you take out time to really cut it off, precious time. I really wish or hope that we too could take that kind of precious time to look after our own, like, what should I do that this thing should not get burst? Because like it or not, like the main mention, concentrated by a yellowy brown digestive enzyme produced by the liver. So you see that it is a chain. If the liver is not good, the gallbladder is not going to work. It's not going to function well. If the gallbladder doesn't function well, there is a high probability that you will not have good digestion. If you don't have good digestion, the next thing is constipation, is bloating, is abdominal pain, and before you know it, maybe it goes on and triggers something like appendicitis, and maybe you pass out, and then people don't know exactly what is happening to you. They take you to the hospital, they don't know exactly what's happening. No, you never chop, no, you don't chop, no, you drink water, no overwork, no fatigue. Meanwhile, it's little things like this. Let's talk about the symptoms when it comes to this. The first things first, we have abdominal pain, you have nausea, fever and vomiting. Let's hang a little on this one. Dear parents, we get to encourage you, get to beg you every day that it's true that maybe the little girl around us might have these symptoms. Yes, these are the symptoms, the first symptoms of pregnancy. We all know. For some people, the symptoms get to manifest. For other people, they go through their pregnancy without even going through these symptoms. But when your little girl in the house is doing things like this, don't just start bashing on that girl, hitting on her, beating her for things that are not there. We always get to encourage you to please take them to the hospital. Why? You're going to discover things that you thought were there which are not even there, and you're going to discover the real reason for why they are maybe having fever or vomiting. Oftentimes we take it upon ourselves that we know a leaf or two that can flow. How many months? How many months? Maybe the child is not even understanding. The child does not have not even done anything, and the child is trying to tell you that I have not done anything, and you don't understand. You still match those leaves and give it to that child. Before you know, you lose your child. Before you know, the child is passed, and before you know, too much blood, the child has lost too much blood, has lost too much blood, and there is nothing you can do about it. Now you carry that child out to the hospital. Bam, mommy, what happened? You yourself, you feel ashamed to actually explain or express what exactly happened to that child. They became a vomit, they became a get fever. Now I check say seriously, parents, please. We should be able to give our children sometimes a little benefit of the doubt. Let's talk about the causes when it comes to this. The first things first is genetics. Yes, oftentimes parents will get to beg you, please, if there is something that is wrong with us in the family that we don't know, maybe we are too careless to know, we don't have that time to sit people down and ask people a question or two. You people should sit us down and tell us that this is what is happening. From every generation to this generation, at least 3 or 4 people have to get this thing. At least 3 or 4 people get to maybe die because of this particular thing or negligence. You don't wait till that time. The funniest or the worst part is that some parents are already very conscious that one person has to die at the age of 21 in the family, and then they are picking. That picking them how many years say, I'm like, blood of Jesus. Like, what exactly is happening? Instead of you sitting them down and talking to them, letting them know, like, understand that this is exactly what is happening. So you have to be careful, you have to do this, you have to do this. So that they jump and pass that barrier or whatsoever thing that has been there, the generational curses. But you don't sit and talk to them that this is what. Sometimes they just sit and then bam, the thing happens. And I want to come and tell you that this is what they happen. That's why they for family. Even your uncle to get no, even the auntie for that side to get no. That's why they. It is not done. Talk to these children. They know a little bit more better than you. They're a little bit more exposed. They can do a lot more research than you. And you too can help them with the research. Tell them the kind of symptoms that you people normally have, so they know exactly how to go about it and what exactly to tell the doctor if they get to sit in front of the doctor. You also have things like obesity, you have rapid weight loss, you have excess cholesterol in the body. We get to encourage you, please. Yes, there is the healthy cholesterol and there is the bad cholesterol. So before you get to maybe eat anything or two, we encourage you, please know and know that this thing that I am eating is good and is bad for me. You also have diseases like the gallbladder cancer. You have biliary dyskinesia. You also have gallstones. These ones are other diseases that can get to trigger you to suffer from gallbladder disease, sorry. And you will never know if you don't get yourself to the hospital. That's just the truth. Because diseases like this, you never know. Your normal eye will never ever get to tell you. But when you get to the hospital, the doctor or the physician might get to tell you, or lab tech results, lab results will tell you, madam, this is what is happening. Oga said, this is what is happening, this is what is not right, this is what you're supposed to do. But when you sit back and want to do it all on your own, there is a high probability that it just might get worse. Let's talk about the prevention when it comes to this. The first things first is for you to drink plenty of water. We always get to encourage you, even if the worst comes to the worst, you have a very busy day, you should at least try to drink water. We encourage you to drink water before you even get to step out of your house daily. A glass or even half is going to go a long way to help you. Plus, even if you cannot get to sit down and eat, you can do what? To eat a lot more fruits along the day. You also have to be able to control your weight, improve on your diet. Yes, especially when it has to do with things that has to do with bad cholesterol. You should be able to note that. Plus, endeavor to engage in any form of physical exercise, the one that is going to help you, not just going to add more harm to the already problem that you have. Just because somebody is running every morning, or maybe it's your neighbor and you want a running partner, doesn't mean that running is the best form of exercise for you. Maybe yours is just jogging, maybe yours is just walking, or you're just doing maybe 2-3 exercises around the compound, maybe jumping ropes and all. That's the one that is good and fit for you. That's not going to add any stress on top of what you are already going through. Let's talk about the treatment when it comes to this. We have 2 forms of treatment. Medications, as always, as will be prescribed, please. The things like this that gets to happen in your internal system, we always get to encourage you and beg on you. Those are the kind of things that you don't see. You don't really see how the medication gets to react. If it's a wound on your body and you apply maybe a pomade, something, and you're going to see that, okay, it's getting dry or it's getting swollen. No, this medication is not nice for it, especially the one that you get to prescribe by yourself. But if it's something that is going inside there, you really don't know what can happen, what that medication can trigger inside there. So we always get to encourage you, please get yourself to the hospital. It is a good thing for you to do. Plus, we also have things like surgery. We really don't want any of you to get into a surgery room, because that is a whole different ball game. You might come out successful as well as not. That notwithstanding, we have some little home remedies for you that you can take in case you get attacked by this. We have the apple cider vinegar. You mix this apple cider vinegar in apple juice and drink within 10 to 15 minutes. It's going to go a long way to help you, especially when you get to